Assalamualaikum and a very good morning to dear lecturers and also my fellow colleague. We are from Group G, supervised by Mr. Hardip. We are going to present about nasal vestibulitis, and these are our group members. For the content of this video, we are going to present about the definition of nasal vestibulitis, the applied anatomy, etiology, the clinical features that will include the signs and symptoms, differential diagnosis, management and also complication. For the definition of nasal vestibulitis, it is an inflammation of the nasal vestibule, which is the area where nose hair grows just inside of our nostrils. It may also be defined as the diffuse dermatitis of the nasal vestibule. So, it is the first area encountered as we move posteriorly through the anterior nares, also known as the nostrils. For the vestibule, the first part of it is covered by the keratinized stratified squamous epithelium, and it contains viscous hairs, and these hairs they have the function to filter inhaled particles. Whereas for the second part of the nasal vestibule, it is made up of the respiratory epithelium. So for the etiology of the nasal vestibulitis, minor trauma to the skin within our noses, such as picking our nose, plucking nose hairs, and also blowing the nose excessively may lead to injury, and this may predispose to nasal vestibulitis. Using nasal sprays and also steroid may lead to dryness of the mucosa and also dryness of the nose. And also, if there is any nasal discharge that may be due to any cause such as allergic rhinitis, sinusitis, and if it is coupled with the trauma of the handkerchief due to blowing of the nose, it may also lead to nasal vestibulitis. Chief complaint and the symptoms of nasal vestibulitis, it is divided into two, whether it is an acute form or a chronic form. So for the acute form, which may be seen by the first picture on the left side, so you can see there's pain, redness, and also swelling of the nose. And at the nostrils, you may see scabs, yellow crust, and also scales around the nostrils. It may also lead to epistasis if it disrupts the Quercebat plexus in the little area. The chronic form of the nasal vestibulitis, patient may have induration of the vestibular skin with painful fissures and also crusting, which may be seen in the second lower picture on the left side.
Clinical features of nasal vestibulitis could be very confusing, as it often presents with pain, redness, swelling, scabs, and epistasis. There are a few differential diagnoses that might come across our mind when it comes to these symptoms: nasal polyps, sinusitis, allergic rhinitis, impacted foreign bodies in nasal cavity, and also trauma to the nose. In managing patients with nasal vestibulitis, treatments often given are warm compressions, analgesics, prescriptions of antibiotics, incision and drainage procedures. Warm compressions and analgesics are often found to be helpful in swelling and pain relieving. Topical antibiotics are often used in mild cases of nasal vestibulitis, and common ointment prescribed are bacitracin and mupirocin. And oral antibiotics given are usually cefalexin, clindamycin, and doxycycline, while intravenous antibiotics often used are vancomycin and daptomycin. Incision and drainage procedures are often done when fluctuant area are formed around the nasal vestibulitis regions. However, it is important for not squeezing the premature swellings. Things to avoid when it comes to nasal vestibulitis is often wash your hands frequently to avoid touching the areas with dirty hands. Avoid excess nose blowing if possible. Do not pick your nose. Avoid plucking nose hairs, but it is advisable to trim them instead. Do not pop the pimples or infected hair follicles. Complications of nasal vestibulitis are nasal furuncles, boils, facial cellulitis, nasal abscess, cavernous sinus thrombosis, and encephalitis. Nasal furuncles and boils are the inflammations of the hair follicles in vestibular regions of nasal cavity. Cellulitis often develops at the tips of nose, cheeks, and upper lips, and ultimately to bloodstreams or lymph nodes. Nasal abscess, predominantly at the septum of nasal cavity, may require intravenous antibiotics or surgical drainage. Nasal vestibule is located in the dangerous area of the face. This is because it is located close to the venous supplies to the brain. It started from facial veins to deep facial vein to pterygoid venous plexus, and then to emissary veins, and lastly to cavernous sinus. Since facial vein rests directly on the muscles of facial expressions, the movement of these muscles may facilitate the spread of septic emboli from the infected area of the lower part of the nose, upper lips, and adjoining parts of the cheek in retrograde directions through deep facial vein, pterygoid venous plexus, and emissary vein into the cavernous sinus, leading to meningitis, cavernous sinus thrombosis. Cavernous sinus thrombosis and encephalitis are brain-related. For cavernous sinus thrombosis, it occurs when bacteria from face spread to cavernous sinus and cause blood clots. The cavernous sinus sits at the base of the brain, just behind the eyes. Cavernous sinus thrombosis is a serious, life-threatening complication and requires immediate treatment. Encephalitis is a serious and rare brain infection. It happens when bacteria or viruses from other parts of the body travel to the brain. Therefore, it is important to notify the early signs of nasal vestibulitis to avoid such kinds of complications. That's all from us, and we hope that you find these videos helpful. Thank you.